Okay. Hi, everyone. This is Sunday morning. I'm with my good friend and colleague, Dr. Eric Lacoste, and he requested an emergency session. I was used to get up soon, but no. I would have appreciated staying in bed this morning. Dr. Lacoste, how are you doing?
Good morning. How are you, Bak?
I'm doing great, but now let's see what was so urgent.
Well, we've been discussing many alternatives, many options. One option that's going through a lot and that we hear is how, when we go back to practice, how the transformations that maybe we will be required to do in our offices, namely negative pressure rooms, the sterilization process, and all those kinds of precautions that might be absolutely necessary, and that will. But at the same time, there's a big risk to all those things that all those measures that have been announced to this point, and it's the cost. So obviously, if we move towards precautions that make the cost go up significantly, and we're talking about serious money to do types of renovations, transform your existing air filtration system and everything, you can have costs that can lead up to probably more than $100,000-$200,000 depending on different cases and depending on the effectiveness of the technology that we would actually bring. So if you put this burden on dental clinics, what's going to happen is costs are going to go up, and then it's going to ultimately go up for patients as well. And that would be to me very bad, because it would have an indirect effect of reducing accessibility to care, which is the very last thing that we want.
But you're talking about 200,000. Where are those numbers coming from?
All those numbers come from different sources that I've checked and I've verified. It's difficult to say per se, but when I looked it up a few years back, because obviously having negative pressure rooms is a high hand of precautions in terms of aerosol or disease transmissions or bacteria flow, and that's what they have in some operating rooms. But the costs are very high. And that's where those numbers come from the studies that I've made, and also from the fact that, when you build something, there's a cost, but when you make renovations, you have to demolish some of what you've already done before reconstructing with different things, and that's where those numbers.
Are you telling me that after this, you had an estimate for 200,000 to renovate your clinic as an operation room that's going to be a negative pressure? But based on the aerosol that we're talking about, this will have to be applied to all hygiene rooms, right? This is what you're saying.
It would have to be applied basically throughout the clinic.
So that's not 200,000 anymore.
No, 200,000 is the whole system. It's not $200 per room. You okay. Can basically, because you don't. There's some steps that you don't have to replicate from room to room, because it's the same system that air goes through.
Knowing yes, today a clinic will cost about about 4 operational rooms will cost about 1 million to build, more from 800 to 1 million. You're saying this will cost about 20% more, 20 to 25% more.
Yes, that's for a new clinic, but an existing clinic, for example, who would have, for example, all the orthodontists who usually practice in open settings. Their operatories are not closed for the most part. They just have small separations. So then you have to build separations. You have to do all sorts of.
So that's going to be even more than 200.
That's going to be even more.
The system to make it work. Then you have to redesign your whole clinic.
You have to redesign the whole clinic in some cases, absolutely, because it just wasn't designed to do that. And because there's also, I'm not an expert in ventilation, but there's the whole airflow system and the rate of change that the air has to go through in order for this thing to be effective. So you have to have a lot of confinements. Your rooms have to be sealed. So even rooms that are closed, if the doors don't currently allow for air to pass, so you have to change all of that. There's a lot of things that it implicates. So those numbers are conservative. They're not alarmist by any means.
Yeah, because I'm listening to you, and I wish you didn't wake me up on this news, because you know that my clinics, it's in a high rise downtown. That might be even more complex because my air is recycled by the rest of the building,
Absolutely.
the way it works. So then that's going to cost me about 500 G. Just the thing is, we have to build something, and then we have to pull it out outside directly. We can not even use the system of the building.
I,
Yeah, okay.
I,
I agree
I,
with you. That was an emergency. I'm laughing now, but I don't know what to say. I also know
well,
that when we interview Dr. Philippe Faux from France, he has no problem because the patient are not paying, the government are paying for them, but he was scared about going back in May, and he didn't know what he has to face uh, about the extra regulation based on all the safety precaution we have to take cost of it.
yes, but at the same time, they still have the same problem because even if the treatments are subsidized by the state or by the country, by the government, I mean, in the end, taxpayers are the ones who are paying for that service. It's just the money is flowing differently. So if the government or if the dentists have to invest even more in a service and the fees that they're receiving are not corresponding to the fees that they're engaging, it just simply won't work. I mean, I've seen some posting and some videos saying, "Is it the end of dentistry?" Well, I think we have to start thinking differently, and there are technology and means that are out there that could allow us to be more effective at cost that may be less significant.
You know, I had two hats because yes, I'm defending dentistry and I'm trying to get our industry through this crisis, but also defending the economy. And to all the people I talk in the economy, say you guys are way more safer than we are because we all always will be always need dentists. The only thing that they just realize is they might not be the same dentists they be seeing because all the dentists right now with clinics might be going to go under, but the profession will last. That's for sure. Now you mentioned something. Then, constantly speaking, this is about 25% of increase in the cost of building a clinic based on your numbers. That will also mean that if that cost will be transferred back to the patient, that's a 25%, or at least, let's say, because the building of a clinic is not the whole thing about the fee structure, but that's at least a 10 to 15% increase in the fees to the patient. Do you have anything in mind? What will you do by May? What will you do? Will you invest? Will you borrow to build up those negative pressure rooms?
Um, Unfortunately, there's one thing that we'll have to obey by regulations. I suppose there's going to be new regulations and new guidelines which we have to obey by. But when I was saying we have to think differently, is I've been reading and watching the news like everybody else, but there's new technologies that have recently been approved by Healthcare Canada where they can do COVID testing, and they can get those results very quickly. It's a DNA-based test. I think that if we were to find new protocols, join experts, sit together, and we were to find a new protocol that will allow us to basically bring in a patient, test them, get the result, and depending on the result, you can then proceed to either treat him or not treat him. This would,
You want to test every single patient coming to a dental clinic?
if we have to, I think it's a very smart way to go, because those techniques, technology can give results in about 30 minutes from what the technology says. It's
Is
been
that
approved
even
by.
feasible? Because right now, 1% of the population is tested. That's taking a lot of resource, and you are suggesting that we test everybody coming through a dental clinic.
Imagine that you have just in Quebec, and I'm not talking about Canada and North America in the United States, but just in Quebec, there's over 6,000 dental offices. If those 6,000 offices are now able to screen test their patient, you relieve the healthcare system by that much, by all the patients that we see. You relieve them by that much. And then you treat those who can be treated, and the ones that may be because obviously we've been doing this for emergency. We've been screening on the phone. We've been assessing risk, but there's still the question about all those asymptomatic patients. So if you're able to test these patients, and if they have a positive testing, you send them home, or if they or you put them in touch with the regular healthcare system so they can be monitored. You're basically helping the system, and you're helping society a whole lot, and we're doing our share, and we're the cost of doing those tests will never reach the cost of rebuilding or reconstructing our offices. It will allow to maintain access to care by not increasing the cost, and that I think is very, very important. Number two, it's very safe, because then the patient that you would then bring and say, okay, he's cleared for treatment, you bring him in a room, and then you generate those aerosols that we've we're always talking about, but they're not any at a higher risk than they were before.
So I like your forward thinking, Doc. I'm just trying to wrap my head around the fact that now you want to test everybody coming through a dental clinic. How do you think the population will react to that? Are those tests invasive?
Absolutely not. They're very those units, from what I've read, are very. You're taking a swab with a cotton, and they're very simple to be performed.
So I'm sorry, but I have to ask, because you scared me this morning with coming up on the fact that I have to invest about $500,000 just to update my clinic. And I don't like the fact that I will have to just invest upon a fear, because we were perfectly safe until now, and suddenly we're not anymore. And this is not just here, it's all around the world. But you're telling me that to test a patient is a swab, and how long is it going to take?
30 minutes.
Okay, it's a swab for 30 minutes. And even we know that most of the people haven't been tested until now. That doesn't make sense to me. Something's wrong here.
Well, this machine was, I think, was just recently approved by Healthcare Canada, by Santé Canada. So it's a brand new technology. It's a brand
3 months too late. Imagine if that happened before. Imagine if we have test screen everybody from the airport. We won't be in crisis now.
Absolutely, and that's what the articles are saying, and from that's how I got interested to the matter in the first place, because that's what everybody has been saying. Just for example, in our elderly home cares, they said, some experts said, well, everybody that's going to go work there, you have to test them before they get in, because if they come in carrying the disease and now they're helping, they're actually, they could be spreading the disease and make matters much worse. This has been said. So, and then the problem seems to be our ability to test and our capacity from the number of people we have versus the number of testing technology available. So now that this technology is available, I think we should really focus ourselves.
We have to look into it. We have to look into it. If I understand your ideas, it's like, let's have one room where people will come into, and as soon as they test, they clear out, then it's life as usual. And we're not talking about 2 weeks in quarantine. We're talking about 30 minutes.
Exactly.
Now we have to look at the cost and the efficiency of those tests. But what you're proposing is, let's just have life as before, but just have a security check. It's going to take 30 minutes. Mm-hmm. I still have to know what else is going to take us. I think it's more than a room and just a person swapping a mouth, that you need maybe the infrastructure coming with it.
At that exactly point, this is where we need to join in with some experts, and then maybe they're going to say, the patient comes in, you take the test, you send him back to his car and wait for 30 minutes or go somewhere and come back where he stays.
You cannot do that, because the thing is, if he is positive, you want to contain him there. We're talking about helping society. But what you're proposing is dental clinic will start to serve as a checkpoint, just as an airport, to just check everyone. And I think that after they've been checked, they should have a bracelet, something said that I'm okay for a while, just for the time that this fear is going away. Because I think that this has cost us way too much, not just to dentists, but to all the society. And what I love about your initiative, it's, that I'm all about the members of our industry. We have to defend the fact that you cannot just impose over them regulation based on fear. Because right now, it is said, until now, we are shooting in the dark, even if we will save lives. We are losing so much more. We're amputating limbs to save lives. And I'm saying it's debatable, but there's a lot here on the line. So our dentists cannot survive that kind of mentality, that's for sure. We have to be more focused, and I think we have to identify the threat where it is and to neutralize it. Not just to have something abroad the scope, say, let's have security everywhere. That doesn't make sense.
But also we have to see it that way. Before being a dentist, we're healthcare professionals. That's what we are at the very base. So now we're talking about a disease that affects, that has tremendous repercussion, that affects the world everywhere. And I think it's just intelligent and normal that we contribute more or in a more significant way. And being able to perform those tests, having the right formation, being prepared to do that is just a tremendous support to the healthcare system.
Actually, don't get me wrong, I'm all with you on this, because in this crisis, dentists all around the world has been put aside from the war effort. Yep. And what we realized, it's the specialists now, all the specialists in the medical field also have been put aside somehow, and now they're getting back. So it's nothing personal against the dentist. But what is so painful to us, it's we have infrastructure on our shoulder to maintain. And this is the waste here. All this infrastructure could have served to help in this crisis. So I love the idea that with this, you're bringing a degree of relevancy to dentists, because our infrastructure, we're on the ground, we're everywhere. There's 3 at every corner.
Exactly, that's true.
How can that be safer? But the thing is that feasible? It's also a question of legality. Who's going to do this? Who's going to administrate the test? Is that going to be a dentist? Is that going to be a staff member? Is that going to be a physician?
I think at this point, the last thing we'd really want to get, and I know that it's going to have to come down to regulations because that's the way it is. But I think that if if leadership and political will, if we put all of that aside and we go to the essential. Right now, the essential is to find ways, to find methodology where we are improving the care and of the whole society. And dentists, they have a very good formation. They're doctors. They're experts of the mouth. They do things that require a lot of dexterity, hand skills, and more importantly, every single day when they work, they have to work in a clean environment. I mean, bugs, bacteria is part of my daily life.
Yeah, it's been 20 years we're doing this. We're so healthy.
I mean, I do surgery every day. I do biopsies. I do all these things. There's absolutely no way that we cannot perform these tests, which according to, I don't want to get into specifics into companies or brands or anything like that, but from everything I read, is very simple to administer. And even in the article, they were saying it could be very, they could use those tests in remote areas like the north, where there's less access to medical care. So the article is actually suggesting that it would be possible from a non-medically formed individual to be able to perform the test and read the result.
That's how. I have to ask, because dental clinics are in the center of the system. Why don't we have just those at the border of the system? So at all the checkpoint, the airports, all the big hubs, test everybody there. And as soon as they arrive in the country, you know that they're safe. Well, not.
It's been suggested, but as we know, no system is perfect. And obviously you may have some false positive or false negative, we don't know. But we have to prepare for those contingencies. But the more testing points you have, and they've been saying this from the get-go. I mean, countries are fighting to be able to do more tests, and they're saying the ones who are doing more tests are better off than the ones who are doing less. And this technology is right there. It's now available. Health Canada approved it, and you have a whole force. You have a whole industry that's right there and available to be able to proceed that in the dental industry.
I love your idea, Doc. I love your idea, and I'm trying to wrap my head around the concept. I hate the idea that I have to invest so much more just to change my air system. This is about protecting the dentist. This is about protecting the staff, but also protecting the public. Not just about the safety of it, but let's keep the cost reasonable. Let's not go out of hand.
Furthermore, not only even if we were to invest that money, I still don't believe that this solution would be better than the solution that we're proposing today. Because if you have all this equipment and you become safer, you don't become absolutely safe, you become safer. And then you're treating somebody.
I like that.
And you also, and then you're testing someone that you're treating someone that you haven't tested. And you don't know if that person is positive or negative. That person has never had access to a test. So you're treating somebody with a high risk patient, and you're treating him in a safer manner, but not a perfect manner. If you're treating a patient for whom you have a much higher degree of certainty that he is not carrying the disease, well, you can write safer, but with bigger letters. So.
But that the way we're structured, it's we're taking ideas and we bring that to our society, and also our industry, and it's a dialogue going on. Are you willing to take this idea and to bring it out there and to discuss with our peers what they think of it? Because this is mainly, they will have to volunteer to do this test. They will have to invest into our function to one level more to be safer, as you say. But that will save so much in infrastructure, and that will save so many clinics from going under.
I think it has to be discussed with peers. I think it has to be discussed with experts. Like I said, by no means am I an expert in that field. I mean, we have fantastic experts in we have experts in microbiology and immunology, pathology. I mean, we should definitely have a table of as many experts as we possibly can, discuss the ideas, find the pitfalls and the problems that may occur, and we can then come up with a protocol. But I'm pretty sure we're on the right track.
The way I see this, and I see things my way, it's let's stop making war to the economy and let's start focusing on the virus. And this is what I like. We're looking at the virus, not of all the side effect risk. And if we take care of this, the rest will be taken care of itself. But mainly, I think that we need to have a panel with, as you said, expert in the field. We have to look at the aerosol, what are the real danger of that, and also, is this going to save everything? Because there's no regulation at this stage. If we act fast, we might be the regulation. If we don't act fast, then we have to react to those regulations. And the worst thing that's going to happen is if we do legislation based on fear, as we are doing today, everything will be triple the standard that it needs, and somebody will have to pay that price. And our industry will die from that.
And I honestly believe that the only way that this will not work to our advantage is if we keep on doing traditional turf wars. And if we avoid that, and experts come together and just think of a solution, of the right solution. The right solution is we need more facilities. We need to be accessibility to testing. Once we have that accessibility to testing, we can resume. And now we're just talking about our industry because that's what you and I know. But I mean, if a patient has been tested negative on that day, he can resume work. He can go into our clinics. He can go to the.
I love you. Now let's bring all my tunes together. We save a patient, we save the economy. And And we save our clinics.
No, because then it's the same thing for for eyes. It's the same thing for feet.
Why
It's
did I
the same
met you
thing.
sooner?
It's the same thing everywhere, and that's what we need to be able to do. I mean, it's amazing how the food industry has adapted so quickly. I mean, you go to the grocery today, and you have to make the line outside, keep the 2 meters. You go in, you wash your hands. They have those hand wash.
Just went to my dentist. I have my bracelet. I don't have to wait anymore. That's a fast pass. We're joking now, but I think that there's something here. There's something strong here that we have to dig in, and we have to act fast. But now, this format of interview is usually 20 minutes. We're at 25 already. And I have to ask, that you and I have another initiative, and it's called the Aftermath. Now you just launched a second one. Are you willing to take this on your shoulder? Because this is more than just ideas. You know that here, if you talk, then you have to walk your talk. Are you willing to have a second initiative on your shoulder?
Absolutely. I'm going to reach out to as much as I possibly can to any experts, to anyone who wants to contribute. And it's by putting our minds together that will go somewhere. So obviously alone, it's not something you can do, but with a panel of experts, it is definitely something that it'd be my pleasure to be part of and to contribute to making.
I'm talking to other people listening to us at this stage. If you want to avoid the fact that you have to invest about a quarter more in infrastructure, that's 25%. And this is conservative. And you don't want to just be impose regulation based on fear or on the fact that we don't know where the enemy is, so let's shoot everybody. This may be, I'm not sure what the implication is, but this may be a better way to target the real enemy, which is the virus, and not just to put an extra burden on everything else. I think you just started a new initiative here. That's the Lacoste initiative I'm seeing right here.
And all that, and what you've said, I still have to add, all that by making a significant contribution to society, making a significant contribution to everybody's health, making a contribution to our economy. All that with the same initiative, all that by doing those small testing and being able to, contribute to spinning the wheel of our economies, of our society.
I'm a lazy guy, you know that. I love the fact that if I do one thing, something else is asked from me. I love this. But here it is. I have to ask you officially. Are you taking an initiative, and is this the Lacoste initiative?
I'll do my very best, I promise.
You know that with me, things can go pretty fast, pretty quickly, and it's going to go big.
I really hope so.
Okay, so everybody here, we're launching the Lacoste initiative. We need your help because this is an idea. It's an idea that if it goes fast, can save our industry and the economy in the same time. Imagine that if all your patient comes to you at the beginning of May, and because you need to treat them, they have to pass a test, which is non-invasive based on what I'm knowing, and that's about 30 minutes based on what you're telling me. And from this, let's say that they have a bracelet and they're okay for a little while, they can resume work. Hey, there's nothing else. Actually, what I love about this, we're not fighting the virus here. We're fighting fear. There's no more fear out of the system after this.
Exactly.
This in New York will go crazy. But crazy. No. Okay, Doc. You have my support. You have my help. Let's push this because you know that my real enemy is fear. I said that from the beginning of this crisis. If we can get fear out of the system, now we're starting to be smart people again.
Definitely.
Who's with us? Who is with us? This is an interview. It's just the two of us, but damn, what are you waiting sooner?
No, we need to get this interview out there. We need to reach out to people, and we need to do it as quickly as we can, and find a way.
All right.
To do.
Actually, we have to finish. We have to finish now. It's 28 minutes, and I won't be able to post this online. But there's no message of hope here. There's a call to action. Reach out for Dr. Lacoste. He'll be leading that initiative of trying to find a safer way for us to resume. And with that, will be also contributing to society to increase our degree of relevancy in the society. And also, after this, people will have a bracelet saying that I can go back to work and I'm safe. Let's win this war against the COVID, but absolutely, let's win this war against fear. Let's stay smart, people. Let's not just bank on toilet papers. This is what I'm saying here.
Absolutely.
And toilet paper can be very expensive. Let's stop here. Let's just stop here.
Yep.
Doug, thank you so much. I love your energy initiative, and especially your forward thinking. This is you gotta keep this for yourself and saying that my click is the safest one, but you choose to come forward to share this with the industry in the name of everybody, all the member of our industry. Thank you.
My pleasure.
You just save us a lot of money.
Let's make it work now.
Let's go. You know that we're not losers, right? We might die trying, but we're not losers. Talk to you soon.
Thank you.
Thank you so much.